All right. Hello, everyone. Thank you so much for joining us. Good afternoon, good evening, good morning, wherever you may be. We're so excited to have you here with us for our great session on pre-med and pre-health advising. My name is Hilary Lundberg. I am an assistant director of admissions here at Northwestern, and I'm going to be kind of your host moderator today from my living room. And we are so excited that we have a couple wonderful colleagues joining us from our health professions advising. And I'm going to go ahead and have those two introduce themselves. Brian, do you want to go ahead and introduce yourself?
Sure. Welcome, everyone. I'm Brian Keiller. I'm in health professions advising at Northwestern and looking forward to meeting you all.
And I'm Tyler Lockman. I'm one of our health professions advisors in the office. I use he, him pronouns. I work with largely pre-med students, but also pre-dental, pre-physician assistant, and pre-pharmacy in some cases. And we're getting new health professions all the time.
Awesome. So we're very lucky to have both Tyler and Brian here with us today. We know that a lot of you out there are interested in pre-med and pre-health. We've heard lots about that from all of you as you're asking questions of us over the last couple of weeks. So we're excited that we can get the real answers straight from the sources here. So for everyone tuning in, feel free to drop any questions you might have about pre-med and pre-health advising into the chat. We'll get to them throughout the session. But just to start off, Brian and Tyler, I don't know who wants to speak first. What do you think is important for students to know about kind of the majors they're choosing, the classes they're starting to take right when they get on campus if they already know they want to be going into that pre-med, pre-health track?
Yeah, so that was actually kind of one of the first things I wanted to cover. At Northwestern, pre-med is not a major or a formal program or concentration. It is really a recommended set of courses and different experiences that prepare you for a strong application to medical school or health profession school. So there's obviously variation across those different career paths, but really there's no specific major students have to choose to be pre-med or pre-health at Northwestern. We have a few majors that are very common for pre-med, pre-health students, but we also see students from across all kinds of majors at the university. I think Northwestern offers something like, you'd probably know better than me, Hilary, but 70 something plus majors. And we encourage students to pursue one that they're interested in. There's really no specific choice that offers an advantage for going to medical school or health profession school.
Great. Yeah, I think that I know that we hear from a lot of students, both in the admissions process, as well as once they've been admitted to the university, et cetera, that one of the reasons they're interested in Northwestern is that ability to maybe combine different areas of study, maybe bring in different kinds of majors and minors. So I don't know if Brian or Tyler, either of you have a really good example of a student you've worked with and a cool, maybe unique academic path that student has been pursuing while sticking to that pre-med or pre-health track.
Yeah, I mean, I can think of an example. I worked with a student recently who was a journalism major. And my undergraduate career, I was in journalism as well. So I know that's a particularly challenging major in its own right. But the student was also pursuing a pre-medical path because they had an interest in writing about medicine and medical careers, as well as potentially moving eventually into like a media setting as a physician as well. So like it was kind of a unique combination there. But certainly I've had students from music majors, students from dance backgrounds, all kinds of backgrounds of students that are able to pursue those things they're really interested in while also following that pre-med or pre-health path.
Awesome. Go ahead.
I can also just give kind of a general overview of the pre-med, pre-health experience at Northwestern, if that's helpful. Great. So I mentioned already, obviously, it's just a recommended set of courses and experiences, and our office is there to help kind of guide students onto that path. So we also advise, though, other health professions. I know I keep saying pre-med, but our office really does advise a number of different health professions. So I already mentioned physician assistant. I work with pre-dental students. We have pre-nursing students. I worked with a student who was interested in going into audiology last year. We have students that are interested in optometry. So there's really a number of different health professions, and we stress to all students that medicine isn't the only path, and often there might be one that's a better fit for you. So a lot of students start with pre-med. We do see students switch. The healthcare field is changing all the time, so there's really a number of different paths for which the demand is going to be very high in the next few years. There are couple of other things to know, just from like the coursework standpoint. I know this is a big question a lot of students have about like what courses do I need to take when I get to Northwestern. For pre-med, it's pretty consistent, and there's a little bit of variation for the other health professions. But just to give the really bare bones overview, students interested in going to medical school typically need to take general chemistry, organic chemistry, a few biology classes, and physics. Also, biochemistry is becoming very common, and there's generally expectations around some math courses, calculus and statistics, as well as English and some behavioral sciences. So that's just a quick overview of the coursework. Again, there's a little variation from kind of profession to profession and what the schools require, but our advisors are always working with students to help set out like a 4-year plan when they get to Northwestern of what courses they'll need for the pathway that they're on.
Thank you so much for that, Tyler. I think it's really helpful to help us establish kind of the baseline of what it might look like to be on one of these tracks. And on that note, we have a great question from Sky, who is curious to whether it's difficult for non-science majors to fit in those courses that you were just talking about that they might need to take for that pre-med track. We were just talking about examples of students who are not majoring in sciences but are still pursuing this. So I don't know, Brian, do you have any good advice about that kind of course management piece for non-science majors?
Absolutely. We find that students always get a schedule that works for them. Depending on the major, they sometimes have to shuffle courses around, but the course availability is there. And typically students are starting out in chemistry. And so we've got 3 different levels of chemistry depending on the student's level of preparation. And I think that's a good place to start in your first year. And of course, it's a quarter system. So we've got 3 sets of courses over fall, winter, and spring. And these courses progress through. So most of our students, first year students, even second years, if you want to come into this later, are starting in chemistry. And they can build decent schedules, yeah, absolutely. I don't think I've had any first year students I've worked with who've not had a schedule that's worked.
I would just add to that, there are a few majors where it might be a little bit trickier to fit in all the extra pre-med coursework. In those cases, often we see students do choose to take a gap year before medical school or bridge year. So that's 1 year in between undergraduate and medical school, where you apply for medical school in your senior year. Having those 4 years to complete all the coursework gives them students more flexibility to schedule out those non-major courses and have everything they need before applying without having to try and crush everything into 3 years and apply as juniors. So we actually do see about 80% of our students take at least 1 gap year before medical school. So it is extremely common. The majority of our students are applying as seniors at this point. Of course, we support students on both pathways, both gap year, non-gap year.
That's really helpful. Thank you both. I think that actually segues really nicely into something that's already come up in our chat. With the actual medical school application process for those students who are going down that particular pathway, whether it's taking place during their senior year and they're still on campus, or maybe they go through that gap year or that bridge year, could one or both of you speak to what that process looks like in terms of the way that your office supports students through the application, as well as kind of generally the experience that Northwestern students tend to have during this process?
I think Brian has a great overview of our services and how we support students. So I'm going to throw it to him for this one.
Yes, I can run through those services for sure. Of course, you asked about application process. Well, there's a little bit of planning goes into this, and there's some underlying strategies that students may go in with and discuss with their advisor, and strategies like Tyler was talking earlier about this gap year strategy. So if a student's going straight through, which would mean they're finishing their undergraduate degree in their 4th year at Northwestern and then going on to med school the September after that, they would typically take the Mcat in the summer of their junior year. So we use that as a kind of milestone, a marker to build around other plans as well. And it's not just the quantitative pieces, GPA, prerequisite courses. The med schools they have a holistic review process, and we'll talk more about that later. But I can tell you about the services that we offer overall on the pathway towards medical school. I think the most important and valuable service that we have is academic advisors. The advisors we have are deeply invested in student success. They're looking at the student through a holistic lens as well. So we're not just transacting a list of classes. We really want to get to know you, find out what your drivers are towards med school. And this often happens in an academic advising appointment. When you first come in as a first year, we start off with a webinar just to orient you to the health professions. For many of the students, as medicine's their goal. As Tyler mentioned, 80% of our students are going into pre-med, not them all. But once you've had that orientation online, we will assign you an academic advisor. And these face-to-face meetings are so valuable. That gives us time for students to get to know us and us to get to know them, and that's important just in the advising process. And then we can advise on different careers within the health professions. There's a lovely link that we can share with you on explorehealthcareers.org, and there's a lot of variation in the health professions there. And that's a typical go-to for us just to get students thinking about what they might be doing day to day. We also advise on course selections, as Tyler mentioned earlier, in all the health professions, and there is some variation there, again, depending on the student's pathway, how quickly they want to get this done, or whether they want to take a gap year. And then we're advising on not just the resources that are available at Northwestern, and boy, we've got a lot of resources. It's a resource-rich institution, absolutely, but also resources in the community, particularly in volunteering, whether that be clinical or non-clinical. And often students are talking about this in those one-to-one appointments. They're typically 30 minutes to an hour. We'll be doing these through Zoom, so we'll get to know you through Zoom online. And we also do these in person, of course, pre-COVID, and we will advise you on anything from the choice of med school, dental school, and through this gap year, bridge year. We also do mock interviews for any of the health professions. It's really a postgraduate degree you're going into, and there's going to be an interview process and an application process. So the advisors are there to help with the mock interview and the application process. That can be through email advising, in-person advising, and then we also have complementary pre-med events and pre-health events as well. So we have all kinds of health profession schools coming to visit us. We recently had NYU, Loyola, Rush in the medical field. We've had optometry schools, dental schools, and other speakers coming to chat with us. And students, I think, enjoy those, hearing how they can best prepare themselves. In addition to these services, we also have workshops. And it helps students on developing a personal statement. Tyler just did one this week. It was wonderful. Lots of students engaged online. And then there's the advice on the application process, which again, depending on when you want to apply and which health profession you're looking at, we get into those details. In addition to that, when you sign up with us, we add you to our listserv, and our listserv during each quarter, we have an events and opportunity newsletter, and we're basically sharing not just local opportunities and events, but also in Chicago, Evanston, and beyond, particularly for summer planning. That's a big demand. There's a big demand for that. And then we also have presentations where, I've seen we have two colleagues in addition to myself and Tyler. There's Mel Pillay and Nancy Tapco. And often Mel and Tyler and Nancy, they're going on the road. And so they'll go to visit classes and talk to biomedical engineering students, to athletes and other student groups. And then, of course, there's our website, which has a lot of good guidance and good information there. So that's a kind of broad view of a lot of the services we have. And we're a well-staffed office, and we are excited to be doing what we're doing. And we get a big thrill out of seeing students going on into their chosen profession.
Thank you so much for that, Brian. Obviously, lots of great information there. And I do know that the advising piece especially is something that often comes up in our conversations with our admitted students, our prospective students, et cetera. So I really appreciate you kind of touching on that piece because that is obviously such an important part of what you're doing in the office. You also brought up research opportunities and kind of those pre-professional chances for students on these various tracks who are working with your office. So I'm hoping that maybe one or both of you could speak a little bit about those opportunities. I know that we've had a question in the chat specifically about opportunities to research at Feinberg, our medical school, while studying as an undergrad at Northwestern, but I would love to hear kind of about research opportunities in general for those students.
Yeah, I'll take that one. I think often the concept or the misconception with the pre-med or pre-health track is that it is only about your grades or your exam score, such as the MCAT. That is not the case. Brian mentioned holistic review at medical schools. They really do care about the experiences you have outside the classroom. We see students every year that have excellent grades and MCAT scores, but they didn't put enough emphasis on getting those experiences pre-professionally that schools care about, and they have a much harder time getting to medical school. So research for sure is one of those big ones. And to the specific question, I have had a lot of students do research at the Feinberg School of Medicine while undergrads at Northwestern. So specifically, there's an intercampus shuttle that actually takes students down to the downtown Chicago campus from Evanston, where the hospital is right there and the medical school is right there, and they're able to go do their research for however many hours a week that opportunity presents. But there's also a lot of research in Evanston as well. So we have students do all kinds of research, from biomedical to psychology, sociology, cognitive science, neuroscience, and really medical schools value all kinds of research. So we have students doing so many different kinds of research on both campuses that our institution has a really great Office for Undergraduate Research that is such a great tool for students to help find those opportunities. I think probably the thing we emphasize even more, though, is the clinical experiences that medical schools are looking for. So that includes clinical volunteering. So in a setting like a hospital, a nursing home, a community clinic, or a hospice, and then shadowing. So the opportunity to observe physicians at work and really get to know how they interact with patients and build that patient-doctor relationship. So there are ample opportunities for that, both in Evanston and Chicago. We always have students at various hospitals around town and shadowing physicians, whether it's that Northwestern or another hospital, or people that they have their personal connections with. I think Brian mentioned this as well, though. We've developed a medical shadowing program at our institution. It's in its second year right now. That's something that we're looking forward to getting back to when campus is reopened in normal circumstances. So we're always looking for additional ways to help students get those clinical opportunities before they're applying to medical school, so they have a really nice, well-rounded application.
And we're very sensitive. We understand that all our students are coming in from different backgrounds, different high school environments. And so that is not an impediment to your success. In the slightest. We have a lot of first generation students and students from a lot of different races, ethnicities that are underrepresented in many of the health professions. And we're here to help them as well, everyone to get on and be successful. That Office of Undergraduate Research, absolutely wonderful. If you were a first generation student like me, I came from a low income background. A lot of these research opportunities are funded, and they're funded all year round. And so for some students, there's a barrier to thinking about, oh, research, I don't know that, I haven't done that, it wasn't available in my high school. We have a wonderful set of folks in undergraduate research. They walk students through this in many of the resources. In the same way as Tyler, Mel, Nancy, myself, we're talking to students about those volunteer opportunities. And Tyler's right on the money. Listen carefully at Tyler. He's got some wisdom there. The activities you do outside of class express your values and your interests, and medical schools are very interested in that, and they're very interested in every student's unique path. So there's no magical formula for pre-health. There's no magical one way of doing it. Unless we look at it through the student lens, the one way to do it is your way and explore your interests and explore what really excites you. That's what's going to make you stand out from the crowd. It's not exactly always your GPA or your MCAT score, your DAT scores. It's not those quantitative pieces. It's where you're coming from. It's you, your authentic interests, your passions, your goals. And we're here, and our colleagues all over campus are really focused on helping you identify some of these interests and also getting engaged. That's a huge part of being at Northwestern, and you'll find there's plenty of things to do.
Thank you both for that. I think that we see so many students who are so interested in taking advantage of all the resources Northwestern has to offer. And I think it's really important to keep in mind that everyone's coming from a very different high school experience. And so knowing about those kind of supports in place to help students access those opportunities is really important. One question that came up that I'm hoping one of you can address is about our undergraduate pre-medical scholars program, or the NUPSP program. So I know that some who are watching might already know exactly what this is, but could one of you explain what it is for those who don't know and kind of explain that process?
Sure. So the NUPSP, again, Northwestern Undergraduate Pre-Medical Scholars Program, it is a program for early admission to the Feinberg School of Medicine. And there are a number of other institutions that have their own similar programs. This one is exclusive to Northwestern undergraduate students. So that is one, I guess you could call it sort of a benefit of being at Northwestern, is this is one program that you would have access to that no other students have access to. So the way that program works, it is an early admission program in which you apply the first quarter, so the fall of your junior year, your third year at Northwestern. There are certain academic requirements for that. You have to meet certain thresholds with a overall GPA as well as science GPA. And then they expect you to have certain levels of the coursework done, as well as having those clinical experiences we talked about. So shadowing, volunteering, and typically some research as well. So there are expectations you would have a lot of that stuff done by the fall of junior year. And obviously we work with students on those applications, getting them prepared, working on personal statements, the letters of recommendation component of that. And the way that process works is that if a student is offered an interview and they get offered an acceptance out of that in the middle of their junior year, they would essentially be securing a place in the Feinberg School of Medicine for after they graduate. So if they would accept that offer, come back and finish senior year, and then begin medical school at the Feinberg School of Medicine. Benefits there are you don't have to do the whole regular application process. You've essentially applied to just the one school, and that's it. You're in. You don't have to worry about doing it to all the other schools or any of those other components. And you also don't have to take the Mcat if you get into NUPSP. So getting it at that point exempts you from having to finish out taking the Mcat and worrying about the rest of the application process. It's a great program for students who are really certain that Feinberg is going to be a good fit for them. And I think Feinberg is motivated to really secure some high quality applicants from the Northwestern undergrad side.
Great. So I know that we popped a link to that program into the chat. So if you have other questions or want more information about it, you can look there for that. We did get a question about the experience for students who are maybe pre-med or pre-health in Weinberg versus perhaps in the other undergraduate schools. Is there a difference in that experience? Is there a difference in resources? Just kind of what that might look like depending on what students are majoring in and which school they're in.
The resources are open to all our students, so I don't really see any main differences. Each school operates in a different way. I think the biggest transition from high school for students coming in is they have many advisors. They'll have a school advisor, they may have a major advisor if they have declared the major, and for many students they haven't declared the major yet, particularly if they're in Weinberg. There's so many majors to choose from. Why not explore? You can still be pre-health, pre-med, and explore some new subjects. So we're accessible to all our students, and the services, we do tailor some services to student groups, but generally it's open access to us. And we do have good relationships with each school and college, so we keep in touch to keep up with changes, so we know what's going on in each school and the college as well.
And just to add to Brian's point,
because most of the students.
Yeah, to add to what Brian said, though it's all totally spot on. The resources are available to everyone, but there will be the real differences across schools might be some of the minor things in terms of what your school requires for graduation, certain seminar type classes, the structure of certain components of the degree. but largely the experience of pre-meds from school to school is pretty similar. And we have students from every college at Northwestern, so the access to us remains the same. There's no benefit to Weinberg or another school. We certainly see most of ours, as Brian said, from Weinberg, but the experience is pretty similar across the board for those students, just really having to focus on also what their school requires of them.
Great. And on a slightly different note, but I think equally important for a lot of students, I know that one big concern for a lot of students who are interested in sciences, pre-med, et cetera, is the opportunity to maybe study abroad and the opportunity to take that time outside of the United States during their undergraduate careers. So could you speak a little bit about whether those opportunities are available, what they might look like, how students might plan for them?
Yeah, absolutely. And I'm sure Tyler will add to what I have to say. I am going to encourage everyone to study abroad. My study abroad was actually at University of Illinois, Urbana-Champaign. As far as pre-health, pre-med students, yes, you can study abroad. Certainly, it's easier to study abroad in the summer, but we can advise each student uniquely and based on their own path. You know, we mentioned whether they're going straight through or taking a gap or a bridge year, depending on the health profession they're going into, and depending on their trajectory, the path they're taking, there are better times to study abroad, and the advisor can work with each student on their own unique plan. And if you really want to study abroad, absolutely. And there are resources for all our students as well. So study abroad is made affordable for all students. So there are monies available for students who may think, oh, I can't study abroad. Again, myself, I was low income. I didn't think I could study abroad. I did, and you can do that at Northwestern as well. And I would really encourage students, if that's what you want to do, the world is out there waiting for you.
Brian really covered it all there, but I would add to that, a lot of our students do study abroad through the global health program at Northwestern. It's something that a lot of our pre-med, pre-health students do a minor in global health or an adjunct major, which means they obviously have their primary major and they're able to add a major on for that global health component. So there is a study abroad piece required for both the minor and the major, and a lot of our students choose that option.
Great. Yeah. And, you know, I'll echo Brian, study abroad is absolutely something that every student who is interested should really consider doing. I know that all of us who ever studied abroad could talk for hours about those experiences. So we do have a question that's a little bit more specific about what kind of support we offer as an institution for students as they are preparing for the dreaded MCAT and they're prepping and studying. What kinds of opportunities and resources does your office offer for those students?
So that's an area where we're actually right now kind of exploring how we might do more for students in terms of preparing for the MCAT. I know our director is working with some partners on campus about exploring ways that we can build in MCAT preparation opportunities. I don't want to say too much about that at this point because it's still in the developmental stages. But as an office, we do support students in terms of connecting them with the right resources that they need to prepare for the MCAT. So whether that's finding the right place for practice exams, potentially a course you might take, and not all students take courses. Really, sometimes it's half our students, maybe less, that choose to take a course. We've also had, you know, that we collect books that students don't need anymore and repurpose those if a student has a limited budget and needs to get access to some MCAT books. But there's no real official like course at Northwestern at this point. We have found the Northwestern curriculum is really the biggest thing that prepares students for the MCAT. It is a rigorous curriculum and it covers all the subjects that are on the MCAT. We always help students to determine what is going to be the best timeline for you to take the MCAT. That's such a key piece of it we find for students is selecting the right time to take that exam and building in the necessary amount of study time to set yourself up for the most success on the MCAT.
And there's wonderful resources online. Some of these resources are free. The AAMC, the American Association of Medical Colleges, they run the MCAT essentially. They've worked with Khan Academy, and there's a lot of study guides and aids that the advisors will direct students to, in addition to the books Tyler mentioned. And there are also, I mean, if you really want to kind of geek out on this, you can type in at AAMC MCAT components, and you can look at every single concept that's tested in the 4 parts of the MCAT. Some students will do this before they take a class, and they can see what concepts they're studying in class and reflect back on the future questions that they'll be asked in the MCAT, long exam, 7-hour exam or so. And I think you can use that knowledge to take better notes in class, and don't throw those notes away from chemistry or inorganic or organic chemistry. Keep those notes, because you're going to come back to those when you're taking the MCAT, maybe as a junior or a senior or beyond. There's no perfect time to take the MCAT. Again, it's back to the student's own path and working with their advisor to identify the best approach for that student.
So I think that the takeaway from what Brian just said is that everybody continue to pay attention in all of your classes, because you never know when those things are going to be really useful for you. So obviously there are plenty of students who know right off the bat that they're interested in that pre-health piece. They know that whether they become a doctor or they go into some other facet of healthcare, they know they're on that path. But what about those students who maybe don't have that figured out, don't start their Northwestern careers working with your office, maybe start their Northwestern careers not taking any science classes whatsoever, and then realize a little bit later on that they might be interested in this pathway? We had a specific question that specifically asked how late one can add the pre-med track. But I think just generally, what kinds of advice and what resources do you offer to students who maybe aren't on that path as soon as they get to campus?
So we definitely have students that come to us later in their academic career and say that they're interested in pursuing pre-med or a different health profession, but didn't start out that way. So there's certainly some challenges we help them navigate in terms of getting the right coursework while they're still at Northwestern, or potentially having to get a little bit of coursework after Northwestern if it's that much later. So to answer the direct question about how late, I think most of our students do determine whether or not they're going to take a pre-med path by sophomore year. So it doesn't have to be right away. But even if you go through sophomore year, having not done any of the pre-med classes, there's still a path to finish all that before graduating. It may just change the timeline of when you would apply to medical school or health professions school. The nice thing about our office is that we never have a cutoff for our services. So anyone who graduates from Northwestern maintains access to our office's services and our advising. So we've had students actually come back to us multiple years after graduating and say, I wasn't pre-med or anything while I was there, but I want to go to med school now. And we'll work with those alumni to make sure that they find a way to get the coursework and the experiences they need to go on to medical school or other health professions school. But I'm working with a few students right now who came to pre-med maybe their junior year. And we worked out a way to get as much coursework as possible while they're at Northwestern, and then figure out what that next step is afterward. Once they have done that next step, they're able to come back to us, prepare their application, and go through all that with us as we remain that resource for them. So short version is probably figuring it out sometime like sophomore year if you want to pursue the pre-med path while at Northwestern. But the other longer, more complicated answer is it's never too late.
Great. And I know that one of the wonderful things about the Northwestern experience and the academic structure at Northwestern is our flexibility. So we are really excited that we can offer those opportunities and those resources to students at really any point in their Northwestern careers, because we know that not everybody has that perfect path carved out quite yet at 18. And on that note, actually, I'm wondering if there is anything that comes to mind as kind of one of the bigger misconceptions about students becoming pre-med while they're on campus, maybe something that you feel a lot of students come into Northwestern assuming about the pre-med track or about pre-health in general, that maybe isn't so true, and that you often find yourselves kind of coaching students through?
Yeah, there's certainly a lot of myths out there, and I think the advisors do a great job at myth busting. Of course, in any myth, there's always a kernel of truth, but I think the idea that you have to be a science major is one of the myths. You do not have to be a science major. We will advise students on the science courses they need for their pre-health track or their pre-med track. But the major itself is something you should choose because you have an interest and a passion for that particular subject. Your success is really based on your engagement. And your engagement really has to come from within. It's about your own goals and what you're looking for. Now, you might not know what those are yet. I didn't when I was 17, 18. And so being open to discovery is such a wonderful way to approach this. Sure, there's a lot of information out there. Some of them look like kind of task lists or to-do lists. Here's the list of pre-health, pre-med classes. But I think you have to look deeper into yourself to look deeper into the track towards a career in the health professions, and thinking about, why are you going into this? What are your values? What are you bringing to the table? And it can be anything. Your hobbies are important. Any of your interests. There's a lot of aspects to things you're doing. The one thing, though, I do think is you do have to test the waters. So you can't just sit in a classroom and say I'm pre-med and not step out the classroom into the community. It's very important to get involved in the various communities, and they don't all have to be clinically related. There's plenty of student groups out there that you can get involved in. My advice to any incoming first years, you already established some interests in high school. Pick the ones you love the most and maybe pursue those. And you don't have to give up music or sports because you're pre-med. You just have to find a balance when you're here. But don't lose part of your identity when you come in because you're pre-med. You'll kind of get lost in that process. And there's probably other myths. Tyler's been doing this longer than me. He's probably heard a lot more of the myths than I have.
I think that one of the biggest myths is around the academics, that's the only component schools care about. They certainly care about those experiential pieces. I mean, I have seen students with a perfect MCAT score and a shiny GPA not get into a single medical school because they didn't get any clinical experiences or they neglected to pursue anything beyond coursework. So it is not just about academics. It's not about just having a high science GPA. That's one of the things that floats around on the internet a lot too, whether it's message boards or forums about certain GPAs you need to get into medical school. And sometimes the average numbers that medical schools have on their websites can be pretty intimidating. But we see a range of GPAs get into medical school every year. Certainly a lot of students have those higher GPAs, but just because you're a little bit lower than that does not mean you're not getting into medical school. We have, like I said, a real true range of GPAs that students have. And sometimes when a student has a lower GPA, they have great experiences. Their motivation is really clear. And that can get you into medical school as well. So I think getting rid of the idea that you have to have straight A's in that first year, or that you can't recover from a C or a B plus in that first year is one of the big misconceptions. And we're always helping students try and remember that it's a long process and there's a lot of grades between the start of college and application, that one isn't always going to be the make or break, and you don't have to have one specific set GPA.
Thank you both for that. I think that those are both really, really useful kind of tidbits for students looking into this process. And it does bring me to another question. What do you think it is about the Northwestern undergraduate experience and the kinds of opportunities available to our students that prepares them for that medical school application process or their careers even in healthcare in a unique way? What is it about Northwestern specifically that really puts them in a good position there?
I was in New York last quarter, and I was getting a tour of the medical school, and I met with a Northwestern graduate, and I asked her that question. It's always wonderful hearing the students' stories because I didn't go to Northwestern as an undergrad, so we have to listen to our students' stories in that regard. And they're all very unique. But I did ask her, what prepared you for medical school? Because she was in her first year at NYU. She's happy because NYU is tuition free. So, and she gave me a tour of the place. Wonderful, wonderful resources available to her. But she said the quality of the science courses and the quality of the was one key component. She also said the quarter system moves at a pretty fast pace. In combination with the challenge of the class, she felt she was very well prepared to be successful in med school. And we have a combination of classes, sometimes for pre-meds who are accelerating and going straight through. That can be a challenging academic journey. She said that medical school was easier for her than parts of undergrad, not at all. And she said that not because Northwestern's exceptionally hard, but she was very well prepared for medical school after her 4 years at Northwestern. And I really appreciate her comments there because, as I say, I haven't been through the experience, so we do have to listen to our students in that regard.
I think the academic rigor Brian mentioned is probably the big one. And that applies to Mcat preparation as well, which I mentioned earlier. We see on average, the average score our students who are accepted in medical school have tends to be 7 to 8 points higher than the national average accepted Mcat score. So our students do tend to do pretty well on the Mcat, and I think that's a credit to the coursework they're taking at Northwestern. So the academic rigor definitely prepares them for what they're going to face in medical school, as well as the Mcat exam. The other thing I would mention is that just at Northwestern, being located partially in Chicago and with Evanston right next to Chicago, there are just so many opportunities to get those clinical experiences, whether it's between opportunities at the Feinberg School of Medicine for research or shadowing, or if it's at the Shirley Ryan Ability Lab, where a lot of our students volunteer. There's the Lurie Children's Hospital in Chicago, where we have a ton of students volunteer with young kids. There's so many opportunities for shadowing. I mentioned earlier, we have a Northwestern Medicine partnership where we send students each quarter out to shadow physicians for 5 weeks at a time. So there's just so many opportunities that are already in place and ones we're looking to develop to help students get both those academic kind of components as well as those experiential components that make a well-rounded, successful application to med school.
Awesome. And, you know, on that note, in terms of the actual application process to med school, we have a great question from Sarah in the chat asking if there are specific additional supports offered to international students who are going through that process, as obviously it can be a little bit different depending on the visa status, depending on the medical schools they're applying to, and all of that.
So that's definitely a challenge for sure. Applying to medical school as an international student is more difficult in a couple different ways. Many public medical schools do not accept applications from international students. So for us, one component is helping students navigate what schools will be open to their application and in what ways can they frame their application in ways that really make it hard for them to say no to that applicant. So it's really for us about navigating kind of the different challenges that international students face. There's a financial element as well that's a little bit beyond our scope, but helping connect those students with the right resources and then identifying what schools make sense for them, as well as just building up what kind of experiences they need. Because often students who come from an international background have a majority international experiences, and that's great, but medical schools also want to see experiences within the US healthcare system. So it's helping them navigate access to those opportunities as well.
And I would say to any international students, we don't know if you're an international student or not. We can't tell by looking at you. We can't tell by your accent. Even if I have an accent, I'm now an American. So, you know, I think letting your advisor know if you're an international student, that can be very helpful to us because we can start the process earlier. But for sure, we have international students applying to American medical schools. And there's a great deal of support for international students. And I say that based on working at other institutions where international students haven't had the same level of support. They do at Northwestern. And, you know, I think letting us know because we're not going to judge anyone by an accent or so we don't know who's international or not. So that is something that if you're comfortable telling us, that can help us in the advising process.
I should add to one thing that we have seen international students accepted to the Northwestern Undergraduate Pre-Medical Scholars Program. So international students are eligible for the early admission program to Feinberg.
So I think the moral of the story is that the communication with your advisors and the communication with those who are there to help you can be really important in this process, regardless of who you are and what you're looking to do after you graduate. So we've talked a little bit about the clinical opportunities, both the importance of those clinical hours and that clinical experience in the medical school application process, but also the kind of benefit that it gives students in getting that more hands-on experience. So would you be able to speak a little bit about how students obtain those experiences? We know they're available. We know that you advertise them. Do many students find those opportunities on their own and work with you to apply to them? Do students have a specific central place they can go to find them through you? How does that generally work?
So for things like volunteering, whether in a hospital or a nursing home or a clinic, those are often opportunities students navigate and find on their own. They have their own application process, training process, orientation to whatever the site might be. But we help students identify ones that might be the right fit for them. And we have listings on our website of a lot of the different sites around Evanston and Chicago as well. So we help students connect with those and kind of navigate how to get involved there. But then for the shadowing side of it, often students will use their own connections. If they know physicians, they can ask for the opportunity to shadow. But with the shadowing program our office runs right now, we do have a process in which sophomores and above are able to apply to that, and we are able to place students in a shadowing opportunity each quarter. So there is some component of us placing students in clinical opportunities, but often for the volunteering, it's students finding their own opportunity that we've helped them identify.
Great. And I'm sure that there's plenty of information on your website as well for anybody who's interested, and some follow-up about that. We did just get a question about maybe the relationship between the integrated science program and pre-med opportunities and pre-health opportunities. Would one of you mind just very briefly explaining the ISP, the integrated science program, and maybe the connection or any sort of overlap between students who are part of that program and students who are working with your office?
So there is a fair amount of overlap in the courses that ISP students are taking with what they need to take as pre-med students. But I won't sugarcoat it. It is one of the more challenging majors to do alongside pre-med. So I certainly see a lot of challenge for the students that are doing ISP with pre-med. But at the same time, by taking on a program like ISP, those students are saying that they kind of invite that challenge. If science is really your thing, it's probably a good match. But definitely is one of those more difficult majors in terms of pairing them together. It could increase the workload a little bit at certain points of the process.
Great. And we've talked quite a bit about the specifics of pre-med and medical school and that particular pathway, but I know that we've touched a little bit on the fact that your office does not just exclusively work with pre-medical students, but also students who are pre-health in general and the different paths that students might take. So could maybe one or both of you give some good examples about maybe students who came into Northwestern who didn't really realize the opportunities for pre-health outside of pre-med and maybe found a different pathway that was still related through your office?
Yeah, absolutely. It's really about students communicating with us and being open to different ideas. I think a lot of students come in with this idea of pre-med, only pre-meds. And then there's two tracks in medicine as well. There's allopathic medicine and osteopathic medicine. So one's the MD allopathic medicine, and then DO, Doctor of Osteopathic Medicine. There's some slight differences there as well you can discuss with your advisor. But we have other programs. Our colleague Nancy Tapco runs a physician's assistant connections program. So the getting connected to someone who is in a program, whether it's Feinberg or another school, and chatting with them, what's it like on that program? I think that can be very helpful to discuss with maybe not so much a peer, but someone who's in that position. And so there are some programs we have where we can connect students to either students in that field or professionals as well. And we do have professionals coming in and visiting our office from different health professions as well. And they're often recruiting for specific schools. But we also have panelists and they talk about their pathway, how they got into what they were doing. And I'll just give an example. I'm sure Tyler's got a lot to these to share as well. But I had a student, both parents are MDs. And she said that, and she was very talented. Clearly, she had the smarts to be an MD, absolutely. But she said that when she was growing up, she didn't get as much time as she wanted with her parents. And it's clearly reflected on this very deeply. And by the time she's a junior, she decided, I think I want to be a physician's assistant because of the type of lifestyle I want to live. It's a shorter academic path. I'll still have similar responsibilities to an MD, but I may have more flexibility in my work day and my work schedule. And that was her perception. So students, I think, come in with different ideas. They may have different role models or mentors that have inspired them. Tyler works with a lot of pre-dental students and has some programming for them as well. I'll let him speak to that, just to broaden this a little bit.
Yeah, just a quick example I would give of a student that was able to kind of explore their interest through something that we do. And I'm sorry, the light is hitting my face here in a weird way at the moment. That's the dangers of doing these from home. We did have a panel one recent quarter. It was called Eyes and Ears and Mouth and Nose. And it was where we brought in health professionals that focus on all those specific parts of the human body. So for the eyes component, one of the people we brought in was an optometrist who was actually a Northwestern alum. And she talked about why she had chosen that career. One, she didn't like the kind of blood and guts element of medicine. And also she preferred the work-life balance that an optometrist had. And a few days later, I met with one of my students who had kind of been unsure about what path they were taking. Then they said they had gone to that event and heard from this optometrist about several different things that resonated with them. And they were like, I want to pursue that. It was what I was thinking about already, but hearing from her about the satisfaction she gets out of that career path and the kinds of people she gets to work with, for her, that was what it took to kind of tip her in that direction, because she wasn't sure about medicine. So really now she's on that pre-optometry path, and she's getting involved in different summer opportunities to take her down that pre-optometry path.
Thank you both so much for those. I think it's so important for us all to remember that your path can really change a lot over your time on campus, and that there are so many really cool resources there to help you find that path, and that you never know which panel or conversation might kind of be that turning point for you. So thank you both so much for that. I know we're getting a lot of buzz about this question, which is hopefully a pretty easy one, but at what point can students start meeting with pre-med, pre-health advisors once they're on our campus?
Yeah, so I knew that would be a question that students have. Everyone's always eager to get to meet their pre-med advisor, right? Basically, the way it works for us is the first contact you could have with our office is during Welcome Week. We do a couple of large information sessions to kind of introduce you to the pre-med, pre-health track. And at that point, students have a chance to ask us their individual questions as well. Throughout that Welcome Week, there's also the chance to interact with us at different academic fairs. And then we do have drop-in hours for all students that week. So they're able to drop in and see an advisor for 5 to 10 minutes just to get a quick appointment. The process beyond that involves about a month into the academic year. We've giving students a chance to kind of settle in a little bit. We do make available the first year pre-med webinar. So it's like a 30-minute presentation that's available to students in the academic portal that our students use. Basically, they just have to complete that, fill out a quick intake form, and from there, they're assigned an advisor. So within the first month and a half or so of being at Northwestern, you can get access to your advisor. Once you have that, you're able to schedule an appointment with them yourself. So finding a time that works with your availability, coming in for a one-on-one, either 30 or 60 minutes. But while the appointments are at first limited, there is opportunity for all students, no matter if you've taken a webinar or not, to get access to an advisor in that first week and beyond.
Great. Yeah, I know that I'm sure every year you have plenty of new students who are kind of raring to go with that path, which is great. We do have a question about kind of academic balance. So if a student is on a pre-med or pre-health track, and especially pre-med with the kind of more specific course requirements, would you say that in your experiences, students who are doing pre-med have maybe 2 majors or 2 big interests? have you found that students are able to still balance that coursework with maybe 2 disparate majors and maybe still even have room for some electives? How would you say that's been in your experiences?
Yeah, we have students doing so many different things and wonderful things. I think it's a process, of course. Some students might think double majors is going to benefit them to get into med school because surely 2 majors, one's going to work. That doesn't work like that. You really want to go with what's interesting to you, and keep in mind it's a process. You know, you can't learn all this in the first week or the first month. And it's very important to get settled in to your studies at Northwestern. And that time management piece is very important. Tyler, do you have?
Yeah, to reiterate Brian's point, I think it is much more valuable for a student to do well in 1 major than it is to do just okay in 2 majors. Or even to do well in 2 majors is not going to be that booster to an application. We never hear medical school admissions representatives tell us, we love to see double majors. At the same time, if a student's interested in double majoring, we encourage that if it's something that you're able to manage. And we have a lot of students that are able to manage that well. I have seen plenty of students do a double major and sometimes even add a minor to that. So it is possible to get all those things in. The big thing is planning. I think figuring out when you need to get all the pre-med things done by and where you can shuffle some of those major or double major courses otherwise. So you're kind of on those dual tracks, and it involves a lot of just working with your advisors to set out when you're going to get all those things you need. The short answer is yes, we have a lot of students double major. It is totally doable.
Yeah, and I think students, you have to be kind to yourself. We know you're all coming in with straight A's. We know you're the top students in the country. But, you know, that first quarter, second quarter, you're going to be tested. There's not a lot of grade inflation at Northwestern. And so, you know, you might not have perfect A's. You know what? That doesn't mean you're not going to be successful. Quite the opposite. You're going to become more tenacious and more focused and buckle down and just get on with it. And that's what's going to make you successful.
To address the other part of that question about exploring other classes, I think often when a student does a double major, there isn't a lot of extra room beyond that to explore things, though this might be fun type course. But within certain majors, such as like Feinberg, there are certain general education requirements, they're called distribution requirements at Northwestern, that do allow for opportunity to explore different subjects. So you might be able to take a literature class in something that you might want to just explore because it's interesting, or a bioethics class because that's something you can do to fulfill a distribution requirement. But when you double major, you are locking yourself into a lot of different requirements that do make it a little bit less flexible in terms of just taking a certain course for fun.
I really appreciate that you kind of throughout this session have emphasized that there's no one path to medical school or to medical professions. And I think that that is important advice for all of our students, regardless of what they might want to do. It's the beauty of Northwestern and our kind of liberal arts model is that we want students pursuing the things they're interested in. And I think that you guys have done a really wonderful job of really illustrating how that might work for pre-med students. So thank you both. We are coming to the end of our time right now. If you have additional questions about health professions advising pre-med, pre-health, the description of this video has the health professions advising link in it, as well as Tyler and Brian's information. We really hope that this was helpful. Just a few things before we sign off. We do have a lot of exciting programming coming up in the next week or so still on this channel, on our YouTube Live. Next week, we're going to have 3 more sessions at 4 p.m. Central Time, Tuesday, Wednesday, and Thursday. We're going to be talking with guests about professional development, internship opportunities, connecting with alumni, some good stuff there. So definitely make sure you're subscribing to our channel to get those notifications. Just hit that bell below us. That also will help you get notifications about any other cool and exciting things we're doing here. And then for those of you who are on Instagram, if you follow us at Northwestern Admissions, we're doing our Friday Cat Chats tomorrow. So we'll have current students doing Instagram Lives, talking at 4 o'clock about arts and entertainment, at 5 o'clock about student media, and at 6 o'clock about women in STEM on campus. So that'll be a great opportunity to ask some questions of some current students and on some topics you might be interested in. Thank you so much again, Brian and Tyler. We really appreciate you taking the time to chat with us and our admitted students today. And thank you to everyone who tuned in. We really hope this was helpful. Thanks so much.
You're welcome. Thanks for hosting, Hilary. You did a great job.
Thanks, everybody. We'll see some of you on campus.
Yeah, I look forward to that. And a shout out to all the first generation students whose parents didn't go to college. We're looking forward to meeting you all.